1981, I was a freshman in college, and people started to die.
And the reality is people are still dying. Tonight we examine the growth of HIV cases in Travis County. Good evening, I'm Robert Hadlock. Shannon Wolfson has the night off. A new report out shows Travis County is one of the healthiest counties in Texas, but it also revealed a big problem, a growing number of sexually transmitted diseases. HIV cases alone are up 40% over the last decade. KXAN's Kylie McGivern asked local leaders what they're doing to stop the rise in cases.
The Austin-Travis County Health and Human Services Department says every 35 hours, someone in our community is diagnosed with HIV, and 1,000 people don't even know they have it.
Some of that reflects some good news in that there is improvements in the treatment and people are living longer with HIV.
Though HIV is no longer a death sentence, Medical Director Dr. Philip Wong says the public health concern is very real, with numbers that continue to grow, particularly among black men.
And do it preventing.
Peter Reed has seen the progression of HIV/AIDS firsthand.
I have been an active AIDS activist since 1981.
It was a call during that time, a call from a friend that changed everything.
And he says, well, I have AIDS and I have 6 months. And he died in 6 months. That was a moment for me that made me realize I needed to do something.
Decades later, Peter's journey led him to AIDS Services of Austin, which serves 6,000 clients in Central Texas. Beyond the statistics, Peter has his own numbers he holds close.
I've lost over 200 friends in the last
200?
Over 200 friends and acquaintances since 1981 to this epidemic.
Motivated by a painful past, Peter and others are working together to create a better future, slashing HIV numbers. What's the biggest hurdle still?
Getting people tested and knowledgeable.
Austin City Council recently approved funding for the addition of one full-time position for the coordination of HIV medical care services. Now, Robert, we've included a list of locations where people can get HIV testing on our website, kxan.com.
Important story. Kylie, thanks. Over the last year, Texas leaders have cut or tried to cut funding for HIV prevention programs and services. Last April, the Texas House slashed $3 million in state funds to prevent HIV. They directed the money towards abstinence education, setting off an angry exchange.
What is your goal?
My goal is for everybody to be abstinent until they're married.
Well, and my goal is for everybody to be walking around AIDS-free, HIV-free, and to me, that's a goal.
Ultimately, the move did not pass the final Texas budget, but then in December, the Texas Department of State Health Services cut funding for Planned Parenthood's HIV prevention program. Since 1988, it has paid for 138,000 HIV tests. Those tests have let 1,200 people know they are infected.